I'm the mother of identical twin girls. They were born 3 months early. I want to say it was 25 or 26 weeks. Brooklyn and Chloe have always been pretty in and out of hospitals and doctor's offices. Chloe's always been like the big sister and a little bit further ahead developmentally than Brooklyn has been, but they've kind of beaten any odd the doctors gave us in the hospital, so we've got some pretty resilient kids for sure. My daughters go to the Carolina Pediatric Therapy in Waynesville. We see behavioral therapy and occupational therapy, so we go twice a week, but once a week to each of those. Before Carolina Pediatric Therapy, Brooklyn would have a very tough time at places like playgrounds. Other children terrify her, and not like loud kids, just other kids in general. Brooklyn will like try to crawl up you and hold on to you and cry. I mean, she spends so much time with her dad and my dad, and still when I would try to leave the house, she would have like full-blown panic attacks and hold onto my leg. So it was like getting increasingly more difficult to do things like even just run to the car to grab something. We still very much have to work through a lot of the like being scared of other kids, but she's gotten so much better. Now she'll actually like make friends with kids at playgrounds. She was having a really hard time eating certain kinds of foods like textures, and because of her lung disease and some other medical issues, always have had a really tough time getting her to gain weight. So for her to not want to eat certain things is like a pretty big deal. And they've done a really good job of like helping me like plan better menus and figure out the things that she does like and how to like make that more effective in her diet. And so they're just helpful all around. When you have kids with anxiety, like it triggers any kind of anxiety that you might have as a parent. So one of the like best things about Carolina Pediatric Therapy, specifically with the behavioral therapist, is that there are some days where she can just tell that Brooklyn has had a bad week and I am super overwhelmed, and so she'll spend 30 minutes just making sure I am okay, because if I'm not okay, I can't take care of Brooklyn. So it's not that she just cares about Brooklyn, it's that she cares about like our family like as a whole. So we thrive at Carolina Pediatric Therapy because the therapists take the time to not just include the daughter who needs the most attention, but to include my other daughter and myself as well, as far as coping skills and I guess lifestyle changes to help us take the best care of her possible without making anybody else in the family feel left out.